Is this contributing anything really clinically impactful or new to the conversation to target ultra-processed foods, or is this something we've really been on for a bit?
So I'd say in theory, we've been on it. This, like I had mentioned earlier, is kind of the first time that the guidelines have taken a really hard stance on ultra-processed foods and advised people to really avoid them. I feel like in general, it does have like a negative connotation when you think ultra-processed. But then you think about certain plant-based and like vitamin-fortified processed foods and the benefits that those potentially introduce. So I think there's been some discussion in favor of at least somewhat processed foods, but I don't think anyone is out there necessarily defending things like Twinkies or Doritos.
Whenever I'm talking to my patients about processed foods, similarly to when I say protein or carbohydrates, I always ask them if they know what that means, because it's a term that's thrown around a lot and we all probably have an idea about it, but there's also a big difference between minimally processed foods, which would be like packaged hard-boiled eggs or frozen vegetables or pre-cut vegetables, things like that are very minimally processed, and ultra-processed or highly processed is the terminology that guidelines use. That's really the first thing that our patients need to understand so they can identify it themselves. I think nuts, like packaged nuts, that's a really good example of something that we know is being a nice, healthy source. Obviously, it has to be packaged and sometimes they're salted. That's considered processed, but minimally compared to, Cheetos and things that are highly processed. So I really do think education about that is so they can identify it and try to limit it as much as they can is what we should be doing. And I do think that that's the emphasis that the guidelines put out is number one, first and foremost, reducing our ultra-processed food.